Did you realize that a heart attack almost never occurs without warning? In truth, your body has been transmitting alert signals for weeks, even months before catastrophe happens. Each year, millions of individuals collapse unexpectedly from a heart attack. But what they did not understand was that their body had been frantically attempting to alert them through strange exhaustion, brief chest discomfort, or even an unexplained sensation of worrying. These could all be silent pleas for assistance from your heart. The most frightening aspect is that up to 80% of heart attacks could be avoided if we identify the early indicators and take action in time. In today's video, we will unveil 8 crucial warning signs that can surface up to a month before a heart attack occurs. Signs you absolutely cannot overlook. Some may appear innocent, but ignoring them could be a deadly error. And sign number 1 is something that many individuals dismiss, yet it could be the final warning before a heart attack occurs. Before we begin, I would love to know where you are joining me from today. Drop a comment below and feel free to ask any questions you have. And make sure to subscribe and turn on notifications, because life-saving health information like this could protect you or someone you love. *** Warning sign number 8. Indigestion or heartburn ***. Most individuals think of heartburn as merely a minor digestive problem, something triggered by a large meal, spicy food, or too much coffee. But what if that burning feeling in your chest was not originating from your stomach at all? What if it was your heart attempting to warn you of something far more dangerous? Indigestion-like discomfort can sometimes be an early warning indication of a heart attack, especially in people who do not experience the classic crushing chest pain. The challenge is that acid reflux and heart-related chest pain can feel almost identical. Both can cause burning or pressure in the chest, and both can occur after eating. But while heartburn is triggered by stomach acid, heart-related discomfort happens when blood flow to the heart is restricted, depriving it of oxygen. Your body does not always make it easy to distinguish the difference. The heart and stomach share nerve pathways. So, when something is wrong with your heart, your brain may misinterpret the signals, making it feel like indigestion. This is especially true for women, diabetics, and older adults whose heart attack symptoms are often more subtle. So how do you know when to worry? If your heartburn comes with nausea, cold sweats, dizziness, or pain spreading to your jaw, arms, or back, do not ignore it. These could be signs that your heart is struggling, and waiting too long could be deadly. *** Warning sign number 7. Unusual fatigue ***. Imagine waking up in the morning feeling more tired than when you went to bed, even after sleeping for a full night. Suddenly, everyday tasks like carrying groceries or making it through the day feel incredibly difficult. You might think it is just stress, getting older, or having a busy life. But what if that deep exhaustion is telling you something more serious? This kind of fatigue is not like normal tiredness that gets better with rest. Instead, it remains, sometimes for days or even weeks, and tends to get worse over time. You may feel completely drained even after simple activities like taking a shower or making your bed. Some people describe it as feeling like they have the flu, but without the fever or stuffy nose. The connection between fatigue and heart health lies in the circulatory system. When the heart is not pumping efficiently, blood flow to the muscles and brain decreases, causing weakness, dizziness, and mental fog. The body compensates by redirecting blood to essential organs, which is why the arms and legs might feel especially weak or heavy. The worse the blood flow gets, the more exhausted you feel even when you are not exerting yourself. Many heart attack survivors say they felt unusually tired for weeks before their event, but ignored it, assuming it was something minor. Do not make that mistake. Your body is speaking to you. Do not wait until it is too late to listen. *** Warning sign number 6. Sleep disturbances ***. You lie in bed exhausted but restless, unable to sleep despite a calm mind. Night after night, you toss and turn, sometimes waking up gasping for air or jolting awake without reason. It is frustrating, but you attribute it to stress, age, or a bad sleep cycle. Sleep disturbances, especially difficulty falling asleep, waking frequently during the night, or feeling unrest even after a full night in bed, can be early warning signs of heart trouble. Most people do not associate poor sleep with heart disease, but the connection runs deep. When the heart is not functioning properly, the body struggles to regulate blood pressure and oxygen levels, both of which play a critical role in restful sleep. One of the most concerning issues is a condition called nocturnal hypoxia, where oxygen levels drop during sleep. This can happen due to reduced blood flow from narrowing arteries, making it harder for your heart to circulate oxygen efficiently. Your brain detects the problem and triggers micro-awakenings, brief moments of wakefulness that you may not even remember, but that disrupt your sleep cycle, leaving you exhausted the next day. Another overlooked factor is the role of the autonomic nervous system, which controls involuntary bodily functions including heart rate and blood pressure. When the heart is under stress due to underlying blockages or an impending cardiac event, this system can become overactive at night, causing spikes in adrenaline and making it harder for you to relax into deep sleep. This explains why many people experience sudden awakenings, vivid nightmares, or even a racing heart while trying to sleep in the weeks leading up to a heart attack. *** Warning sign number 5. Mild shortness of breath ***. You are walking up a flight of stairs, something you have done 1,000 times before, but this time something feels different. Halfway up, you suddenly feel winded, like you have just run a marathon. You stop for a moment, trying to catch your breath, but the air does not come as easily as it should. Maybe it is just exhaustion, maybe you are out of shape, or maybe it is something far more serious. Mild shortness of breath is often missed as an early sign of heart problems. Many people think of breathing issues as being caused by lung problems like asthma or a cold, but the heart and lungs are closely linked. When your heart has trouble pumping blood, your lungs have to work harder to help you breathe, which can lead to unexpected breathlessness. The key difference between normal breathlessness and heart-related shortness of breath lies in when and how it happens. If you are winded after an intense workout, that is normal. But if you suddenly find yourself gasping for air during routine tasks like walking, climbing stairs, or even talking, that is a red flag. In some cases, shortness of breath can even happen while resting or lying down, forcing you to sit up in the middle of the night just to breathe properly. This is because fluid can build up in the lungs when the heart is not pumping effectively, a condition known as pulmonary congestion. This symptom is particularly dangerous because it tends to creep up slowly. At first, you might notice slight breathlessness when exerting yourself, but over time it takes less and less activity to make you feel winded. Many people ignore it, believing it is just aging or lack of fitness. But when shortness of breath gradually worsens without explanation, it often points to an underlying heart issue. ***. Warning sign number 4. Pain or discomfort in the jaw or neck ***. Jaw or neck pain is often a sign of a heart attack that people tend to overlook. While many are aware of the intense chest pain that can come with heart problems, discomfort in the jaw, throat, or neck does not usually make people think of heart issues. As a result, many might brush it off as something unimportant, not realizing it could actually be a serious warning from their heart. Heart-related pain can sometimes show up in surprising places like your jaw, neck, or even your teeth. This happens because the heart does not have pain receptors like other parts of the body, such as the skin or muscles. Instead, when the heart is in distress, like when there is not enough blood flowing through it, it sends signals through a nerve called the vagus nerve. This nerve travels from the brain down through the chest and into different areas of the upper body. As a result, the brain may mistakenly interpret heart pain as being from your jaw or neck. Another tricky aspect is that this type of pain can come and go. One day you might feel a slight ache in your jaw, and another day you could notice stiffness in your neck. Sometimes the discomfort might even vanish for a while, only to come back when you are feeling stressed, or after some physical activity. This on and off pattern can make it easy to ignore until it becomes really serious. So how can you tell if your jaw or neck pain could be a warning sign from your heart? If the pain comes on suddenly, feels different from what you are used to, or is accompanied by other symptoms like trouble breathing, nausea, dizziness, or tiredness, do not ignore it. If the pain becomes worse when you are active but gets better when you rest, that could be a serious sign like angina, which signals that your heart is not getting enough blood. Asterisk asterisk warning sign number 3. Dizziness or lightheadedness asterisk asterisk you are going about your day when suddenly the world tilts. A wave of dizziness washes over you, and for a moment, you feel completely unsteady. Maybe it is just dehydration. Maybe you stood up to fast, but then it happens again. You feel lightheaded, almost as if you might pass out. It passes after a few seconds, and you shake it off. But what if this momentary spell of dizziness is not as harmless as it seems? One of the first signs that your heart is not doing well can be a sudden feeling of unsteadiness or faintness. It is essential to pay attention to these feelings, as they could indicate that your heart needs some help. Your heart pumps blood that is full of oxygen to every part of your body, including your brain. If your blood flow gets restricted, like when your blood vessels shrink, or if there is a heart issue, your brain might not get enough oxygen. This can cause you to feel dizzy or like you might faint, even when you have not been doing anything tough. Some people describe it as feeling weak, as if their body wants to give up, while others feel an odd floating sensation, almost like the ground is moving beneath them. Unlike dizziness caused by dehydration or a sudden change in posture, heart-related dizziness tends to come out of nowhere. It does not always follow a predictable pattern, and it may happen while you are sitting, standing, or even lying down. So, how do you know when dizziness is a cause for concern? If you experience repeated episodes of lightheadedness that do not have an obvious cause, or if it is paired with other symptoms like fatigue, shortness of breath, or chest discomfort, do not brush it off. Your body is giving you a warning, and the sooner you listen, the better your chances of preventing a life-threatening heart attack. Asterisk asterisk warning sign number 2. Pain in the upper back or shoulders asterisk asterisk. You stretch your shoulders, trying to shake off the dull ache spreading across your upper back. Maybe you slept in the wrong position. Maybe you have been sitting too long. You roll your shoulders, hoping the discomfort will pass, but it does not. Instead, it lingers, creeping into your shoulder blades, sometimes even radiating down your arms. It is annoying but not unbearable. Pain in the upper back or shoulders can be an early and overlooked warning sign of a cardiac event. Unlike sharp, stabbing pain from an injury, heart-related discomfort often feels like a deep, spreading pressure or tightness. This happens because the nerves that transmit pain signals from the heart do not always send them directly to the chest. Instead, they can radiate to other areas, including the back, shoulders, neck, and even arms. Certain people are at higher risk of experiencing upper back pain as a heart attack warning sign. Women, diabetics, and older adults are more likely to feel discomfort in areas other than the chest. People with high blood pressure, high cholesterol, or a history of smoking are also at greater risk. If you fall into any of these categories and notice unexplained back or shoulder pain, do not ignore it. It is always better to be cautious and check in with a doctor if you are unsure. Asterisk asterisk warning sign number 1. Mild chest discomfort that comes and goes asterisk asterisk. Intermittent chest discomfort is one of the most dangerous but frequently ignored signs of an impending heart attack. The key word here is intermittent. It does not always feel severe, and it does not always stay. Instead, it comes and goes, leading many to believe it is nothing serious. But what is really happening inside the body is far more alarming. When the blood flow to the heart is limited, the heart does not get enough oxygen for a short time. This can make it harder for the heart to pump effectively and do its job properly. This condition, known as angina, triggers discomfort, not always pain, but a sensation of tightness, pressure, or even heaviness in the chest. Unlike a heart attack, angina is temporary. The discomfort might last a few minutes, then disappear as the heart gets enough oxygen again. That is why so many people ignore it. But here is the danger. Angina is not a harmless symptom. It is a direct warning that a heart attack is on the horizon. At first, you may only notice the discomfort during physical exertion, walking up a hill, carrying groceries, or even feeling stressed. It fades when you rest, making it easy to dismiss. But over time, as the arteries become more clogged, the discomfort starts appearing with less effort. Eventually, it may happen even when you are sitting still. When that day comes, you may only have hours or minutes before your heart is pushed beyond its limit. Another reason this symptom is so deadly is that it does not always feel like pain at all. Some people describe it as a tightness in the chest, like a band being squeezed around them, a heaviness as if something is pressing down on them, a burning sensation mistaken for heartburn, a fullness or discomfort almost like bloating in the chest. And sometimes it is not even in the chest. It can radiate to the arms, shoulders, neck, jaw, or even the upper back. If the discomfort becomes more frequent, lasts longer, or appears with symptoms like dizziness, nausea, cold sweats, or shortness of breath, do not wait. By the time the pain becomes severe and constant, you may already be in the middle of a full-blown heart attack. Appropriate avoidance measures. A heart attack does not come out of nowhere. It is the result of years of silent damage. You have the power to prevent it. Every choice you make today affects your heart tomorrow. Your diet is either fueling disease or fighting it. Ditch processed foods, trans fats, and excess sugar. Instead, nourish your body with whole foods, vegetables, lean proteins, and heart-healthy fats like olive oil and fish. Every meal is a chance to protect your arteries. Exercise is not just about fitness, it is about survival. Your heart is a muscle, and without movement, it weakens. Even a 30-minute brisk walk daily can reduce your risk. Sitting too much, it is time to change that. Stress is a silent killer. Chronic stress spikes blood pressure, tightens arteries, and inflames the body. Learn to manage it through meditation, deep breathing, or simply setting boundaries. Your heart needs peace as much as it needs oxygen. Smoking and excessive drinking are destroying your heart from the inside out. Quit smoking now. Every cigarette damages your arteries. Alcohol, keep it in moderation. The damage accumulates faster than you think. Silent killers like high blood pressure, cholesterol, and diabetes must be controlled. Regular checkups can save your life. If you do not track these numbers, you cannot manage them. Your heart's fate is not sealed. It is shaped by your daily actions. Start today. Your future depends on it. If you found this video helpful, please remember to hit the like button. It really helps us at Balance Health bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you would like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you can never miss out on our latest health tips and insights. Stay informed, stay healthy, and we will see you in the next video. But vitamin K's role does not stop there. It is also an essential nutrient for joint health and muscle function. Many people overlook the fact that healthy legs require not just strong bones, but also flexible joints and well-functioning muscles. Vitamin K has been shown to reduce inflammation in the joints, which can slow the progression of osteoarthritis and alleviate knee stiffness, a common complaint among older adults. If your knees ache when you move or feel stiff after sitting for too long, vitamin K might be the missing nutrient that could help ease discomfort and keep you moving freely. Poor balance, difficulty walking, and an increased risk of falls are often linked to weakened leg muscles. Emerging research suggests that vitamin K helps support muscle strength and coordination, particularly in aging adults. It does this by regulating calcium levels within muscle cells, ensuring proper contractions and preventing the kind of uncoordinated movements that can lead to instability. Spinach, kale, Swiss chard, collard greens, and Brussels sprouts are some of the richest sources of vitamin K1, the form most commonly found in plants. However, another powerful form of the vitamin, vitamin K2, is found in fermented foods like natto-fermented soybeans, aged cheeses, and certain animal products like egg yolks and liver. K2 is particularly beneficial because it stays active in the body longer and plays an even greater role in directing calcium into bones rather than arteries. If you are looking to boost your vitamin K levels naturally, the best strategy is to increase your intake of green vegetables and fermented foods. Even adding a daily serving of kale to a smoothie or incorporating a side of sautéed spinach into your meal can make a big difference. However, for individuals who have difficulty absorbing vitamin K from food, especially those with digestive disorders or on long-term antibiotics, supplementation may be an option. But caution is key. If you are on blood-thinning medications like warfarin, it is essential to consult a healthcare professional before increasing your vitamin K intake, as it plays a role in blood clotting and can interact with these medications. The coordination expert. Vitamin B6, also known as pyridoxine, plays a far greater role in leg strength and muscle function than most people realize. While many nutrients contribute to mobility, B6 is essential for maintaining nerve health, supporting muscle repair, and ensuring that the body effectively utilizes protein to build and maintain muscle mass. Without it, even the strongest muscles can weaken over time, and simple movements like standing up from a chair or walking upstairs can feel disproportionately exhausting.
One of the most overlooked aspects of vitamin B6 is its connection to nerve signaling and coordination. When B6 levels are low, these signals can become sluggish or misdirected, leading to numbness, tingling sensations, and even unsteady walking patterns. Many older adults mistake these symptoms for aging-related muscle loss, when in reality, their bodies are simply lacking the right nutrients to maintain proper neuromuscular function. Another crucial function of vitamin B6 is its role in preventing inflammation-related muscle fatigue. B6 helps regulate inflammatory responses in the body, reducing muscle discomfort and keeping the legs more flexible and resilient. If you have been experiencing persistent stiffness or slower recovery after activity, increasing your intake of vitamin B6 might be a game changer. Beyond muscle function, vitamin B6 is also vital for red blood cell production. These cells transport oxygen throughout the body, fueling muscles and ensuring they have the endurance needed for sustained activity. A deficiency in B6 can lead to lower hemoglobin levels, which means your muscles may not receive the oxygen they require, causing early fatigue, heaviness, and reduced stamina. If you have ever felt unusually tired after short walks or light physical exertion, it could be your body's way of signaling a need for more B6.
Where does this essential vitamin come from? Thankfully, B6 is abundant in a variety of delicious and accessible foods. Poultry, fish such as salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals are excellent sources. Incorporating these foods into daily meals can naturally replenish your B6 levels, supporting both nerve function and muscle strength. For individuals with digestive issues, poor nutrient absorption, or dietary restrictions, B6 supplementation may be necessary to achieve optimal levels. The recommended daily intake of vitamin B6 varies by age and gender, with older adults typically needing around 1.5 milligrams per day for women and 1.7 milligrams per day for men. While it is generally safe to obtain B6 from food, excessive intake through high-dose supplements should be approached with caution, as long-term overuse can lead to nerve damage. The best strategy is to focus on a balanced diet rich in B6 sources, ensuring a steady supply without unnecessary risks. If you found this information helpful, please remember to hit the like button. It really helps us bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you would like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights from Balanced Health. Stay informed, stay healthy, and we will see you in the next video.